If your partner has ever elbowed you in the middle of the night because you stop breathing, or if you wake up exhausted no matter how many hours of sleep, I want you to watch this video because there's a good chance you have obstructive sleep apnea. And there's an even better chance that nobody has told you what to do about it. Hi, I'm Dr. Eric Jackson from Jackson Family Dentistry in Downers Grove, Illinois. And today I'm going to walk you through exactly what sleep apnea is, why it matters a lot more than what people think, and what your options are, including one that doesn't involve strapping a machine to your face every night. Let's get into it. Sleep apnea is a condition when your airway partially or completely collapses while you sleep. When that happens, your brain registers a drop in oxygen and jolts your body just enough to restart breathing. You don't fully wake up, but that interruption happens, sometimes dozens of times an hour, sometimes more than 100. There are 3 types of sleep apnea. The most common is called obstructive sleep apnea, or OSA. This is a mechanical problem. The muscles in the back of your throat relax too much during sleep, and the airway narrows or closes. Think of it like a garden hose that gets kinked. Air's got nowhere to go. The second type is central sleep apnea, much rarer. That's when your brain doesn't send the right signals to the muscles that control breathing. It's a neurological issue, not a mechanical one. And the third is called complex sleep apnea. It's a combination of both. The vast majority of patients I see have obstructive sleep apnea. And that's what we're going to focus on today, because that's also where dentists play a very direct role in treatment. The classic sign everyone knows is snoring, but snoring alone doesn't mean you have sleep apnea. And sleep apnea doesn't always come with loud snoring. So let's talk about what to actually look for. Most people who have sleep apnea have no idea they have it. They just think they're tired, or a light sleeper, or stressed, or getting older. Here are the actual warning signs. Loud, chronic snoring, especially if it's interrupted by gasping or choking sounds. Waking up with a dry mouth or a headache, both caused by oxygen dips that happen during apnea events. Daytime sleepiness, falling asleep at your desk, on the couch right after dinner, or worse, while driving. Difficulty concentrating, mood changes, irritability, memory issues, waking up repeatedly to use the bathroom, which is often an apnea-triggered event, not a bladder issue. And for men specifically, there's a correlation with erectile dysfunction that many doctors don't think to mention. Now, here's the part that gets my attention as a clinician. A lot of these symptoms get written off for years. Patients get told to lose weight, drink less caffeine, stress less. Meanwhile, every single night, their oxygen levels are dropping, their heart is working overtime, and their body is paying the price. It doesn't announce out loud. Which brings me to the part of the conversation that people aren't having. Sleep apnea isn't just about being tired. Untreated obstructive sleep apnea is independently associated with some of the worst serious health conditions we deal with in medicine. Cardiovascular disease. People with untreated sleep apnea have significantly higher rates of high blood pressure, heart attack, and irregular heart rhythms, including AFib. Every time you stop breathing, your body releases a surge of stress hormones. Over years, that takes a toll on your heart. Stroke. The risk of stroke is dramatically elevated in people with untreated sleep apnea, even after controlling for other risk factors like obesity and hypertension. Type 2 diabetes. Sleep apnea disrupts how your body processes insulin. The connection between sleep disordered breathing and blood sugar connection is well established and often underappreciated. Cognitive decline. Poor sleep over years, especially fragmented, oxygen-deprived sleep, is now being studied as a risk factor for dementia. Your brain consolidates memory and clears metabolic waste during deep sleep. When you're not getting real deep sleep, everything breaks down. And there's a more immediate risk I want to name plainly: drowsy driving. The National Highway Traffic Safety Administration estimates that drowsy driving causes tens of thousands of crashes a year. People with untreated sleep apnea are significantly overrepresented in that number. I'm not saying this to scare anyone. I'm saying it because most people think sleep apnea is an annoyance. It isn't. It's a medical condition that shortens lives when it goes untreated, and it's very treatable. The definitive test for sleep apnea is called a polysomnogram, otherwise known as a sleep study. Traditionally, that meant spending a night in a sleep clinic, wired up to monitors while a technician watches your sleep patterns from another room. These studies are still the gold standard for complex cases especially. But the good news is that home sleep testing has become widely available, accurate, and affordable. You can now do a validated sleep study in your own bed with a small device you wear on your wrist or finger overnight. The results measure something called the Apnea-Hypopnea Index, or AHI, which tells us how many breathing interruptions per hour you're having. Mild is 5 to 14, moderate is 15 to 30, and severe is more than 30 events per hour. If you have any of the symptoms we talked about, or if your bed partner has mentioned anything to you, getting tested is the right move. It's not complicated, and it answers the question definitively. Once you have a diagnosis, you have options. And this is where the conversation gets more interesting than most people expect. CPAP is an option, the continuous positive airway pressure machine. It's the most well-known treatment, and the most effective one for moderate to severe sleep apnea. It works by delivering pressurized air through a mask to keep your airway open throughout the night. When people use it consistently, CPAP is genuinely excellent. It eliminates apnea events, it normalizes oxygen levels, and then health benefits show up relatively quickly. The problem is compliance. Studies show that a significant percentage of CPAP patients don't use it consistently, often because of discomfort, claustrophobia, or the inconvenience of traveling with the device. A treatment that works perfectly but sits on your nightstand isn't really effective. That's where oral appliance therapy comes in, and this is where your dentist becomes a key part of the team. An oral appliance, sometimes called a mandibular advancement device, is a custom-fitted mouthpiece, similar in concept to a sports mouthguard or a hard night guard. It works by gently positioning your lower jaw forward, which pulls the tongue and soft tissue away from the airway and keeps it open while you sleep. Oral appliances are FDA cleared for the treatment of snoring and obstructive sleep apnea. They're a first-line treatment option for mild to moderate sleep apnea, and they're an approved alternative for severe sleep apnea patients who can't tolerate a CPAP. They're small, they travel easy. Most patients find them far more comfortable than a CPAP, and compliance rates, meaning people who actually use them every single night, are substantially higher. Higher compliance means better outcomes. Dentists who focus on sleep medicine are uniquely positioned to help with this. We understand airway anatomy. We're skilled at custom oral appliance fabrication. We do close follow-up to fine-tune the fit and monitor for any bite changes over time. We also coordinate directly with your physician and sleep specialist because this is a team sport. At Jackson Family Dentistry, I've been providing oral appliance therapy for sleep apnea patients for years. If you've been diagnosed, or if you're suspicious that you should have been, I want to have that conversation with you. If anything in this video sounds familiar, if you're tired, if you're snoring, if you've been told you stop breathing at night, don't just keep pushing through it. Give us a call or visit our website to schedule a consultation. I'd love to help you have a good night's sleep and get healthier. Thanks for watching. Appreciate all your viewership. If you like it, give us a thumbs up, subscribe, and I'll see you in the next video. Thanks. Bye-bye now.